let's turn to the United States, where data from Johns Hopkins University shows a record surge in COVID-19 infections around the country, a pretty different situation to the one we're experiencing here in Australia. 166,000 new cases have been recorded over a 48-hour period, and 35 states saw more cases last week than the week before. It comes as the White House deals with another outbreak. The Chief of Staff and a number of aides to the Vice President Mike Pence this weekend tested positive to COVID-19. And in an unusually candid admission, the White House Chief of Staff says the administration isn't going to control the pandemic and is instead focusing on the search for a vaccine. Earlier, I spoke with Amesh Adalja, an emerging infectious diseases expert at Johns Hopkins University. Dr. Adalja, welcome.
Yeah, thank you for having me.
The White House Chief of Staff has said the administration would not control the pandemic and instead would focus on vaccine development. What's your response to that?
Well, in one sense, it's an admission of what we've known all along, that there was no comprehensive plan to get the level of infection down to a manageable level. But I think this really reveals kind of an abject failure by the administration to actually put in place the principles of testing, tracing, and isolating that we know would allow people to get back to their lives a lot sooner. While I think it's important to pursue vaccines and medical countermeasures, you can't do that in the absence of actually controlling the infection, because we've had 200,000 deaths in the United States that didn't need to be of that magnitude. We didn't need to have as much disruption as we've had. And I think that this really speaks to the fact that there is clear incompetence when it comes to the way this outbreak was managed in the United States.
What message is being sent by allowing Mike Pence to continue campaigning while his staff have the coronavirus?
It seems to me that based on all the evidence that's been made public, that Mike Pence has had several significant exposures to this virus. And a person like that should be self-quarantining. We don't know all the details about his medical condition and what his doctors have deemed his risk to be. Were people wearing masks? How long were the encounters with individuals? But I do think that by all measures, it seems to be that he is a significant exposure and should be someone that's self-quarantining and not somebody that should be interacting with individuals at this point. This is based on CDC guidance, and the vice president is subject to CDC guidance just like every other American should be.
Dr. Anthony Fauci says we'll likely get clarity on a vaccine by the end of the year, but it won't be distributed, of course, until later next year. Is that still optimistic?
It is optimistic, but I do think that we're getting more and more evidence that what's going on with Operation Warp Speed, what's going on in the phase 3 clinical trials is promising, and we likely will probably have data on phase 3 clinical trials by the end of November, which will likely lead to an emergency use authorization, possibly only for healthcare workers early on. But I do think that we are looking at something that is a record-breaking speed to get a vaccine. Although there may be problems with manufacturing scale up, and we have to take that into account, as well as problems with logistics and distribution, I do think that probably well about the middle of 2021, most Americans, and I think most parts of the developed world, will have access to a vaccine.
Johns Hopkins University data shows there's been a surge in cases across 35 US states. What can you tell us about that data?
Well, we expected this. We knew that as it got colder here in the Northern Hemisphere, people will be doing more activities indoor. People are also getting pandemic fatigue. This is now the 10th month of this virus. And people are getting back to some semblance of their normal life. Schools are opening. We're having fans in stadiums for professional sports. We are having people interacting with each other, having small gatherings. So this was expected. And many states did not invest in the public health infrastructure to do the testing, tracing, and isolating that we need to do. We still have problems with outpatient testing with long turnaround times. We still have places where contact tracing is not robust. And if you put that into the mix, you're going to find the situation that we see in many of these states. And it didn't have to be this way. We didn't need to see hospitals in places like North Dakota and Wyoming and even in Texas back in crisis again, having to set up field hospitals and auxiliary care sites. We could have had a much better path with this virus if we would have taken the correct actions, if we would have followed science, if we would have talked about what the importance of face coverings are, if we would have talked about the need to get contact tracing robust before people started to interact so heavily at the same time as the weather changed and accelerated the transmission of the virus.
University of Washington modelling has found that more than 500,000 lives could be lost by February. How does the United States turn that around? I mean, that is just such a disturbing trajectory of potential death that the United States is now on.
We could turn it around any minute if we actually invested in the test, trace, and isolate procedure. If we started to have tests available to people, even home tests where the technology exists, but there really isn't any will to implement those tests. If we embolden public health departments to be able to do robust contact tracing by giving them the resources, if we restored the CDC to its place of prominence instead of the backseat that it's been in since the very beginning of this, if we started talking about the fact that we're living in a pandemic and that we have to take certain actions to be able to decrease the spread of this virus. And these are common sense actions. It doesn't mean shutting the country down. It means wearing a face covering, avoiding crowded spaces. It means washing your hands a lot. If we had those messages really accepted by the American public, we would avert this disaster that we've seen be projected.
Joe Biden says if he does win the election, he'll make masks mandatory nationwide. What kind of effect will that have, do you think? How much will that help in reducing the spread of this deadly virus?
Well, what we've learned through this pandemic, and not a lot of this evidence existed at the very beginning of it, is that face coverings do help decrease transmission. I don't know what the effect of a mandate may be. I do think it would be important to have our government leaders embrace the science of masks. Whether or not people are going to follow a mandate is another question.
I want to just make a comparison to what's happening in Europe. France's population is 5 times smaller than the United States, but yesterday recorded more than 50,000 infections. Now, much of the country is facing increased restrictions and, of course, a curfew as well. Do you ever see the US taking on rules like that?
No, I don't think that that's the correct way to approach this virus. I think what we need to do is really targeted public health, looking at the epidemiology. Not every interaction is spreading the virus. And I think if you can target those activities, maybe that's restaurants, maybe that's bars, maybe it's large gatherings, if you can target it, it's much better, because we do know that when you issue stay-at-home orders or lockdowns, that does cause a lot of collateral damage. And that is eventually going to end up causing other diseases to increase in their prevalence and in their severity. And we want to make sure that we're not following this kind of reflex to shut everything down, but actually taking the actions that are meant to curb the spread of the virus and have as little off-target effects as possible. It's an easy thing to run to a shutdown, but it's not necessarily the best public health policy because of all of the ancillary and auxiliary and cascading impacts these shutdowns have. So if you have data that tells you what's spreading the virus and what isn't spreading the virus, you will target those activities that are spreading the virus while leaving the other parts intact. And at the same time, make sure that you're actually investing in testing, tracing, and isolating the way that countries like Taiwan have done from the beginning.
Thank you so much for joining us.
Thank you.
And that's Dr. Amesh Adalja from Johns Hopkins University.